it's incredible to me that these animals seem to really value just sitting next to me. I see 20-year-old cats who look a lot better than some younger animals that I see, which I think is what you were driving at. Yeah. A year of my dog's life is a larger percentage of their life than a year of my life. If I'm going to the doctor once a year, maintain my health, but a chronological year is a much bigger percentage of the life, doesn't it follow that I should look more frequently to see if anything's changing sooner than that year?
Hi, I'm Ronen, and I'm the founder of AVE, a pet wellness program that helps pet owners extend the healthy lifespan of their dogs and cats. With me is Dr. Hilary Israeli, a vet for the past 25 years or so. Yeah, from UPenn.
Yes, I was in the class of 2000.
Perfect. And Hilary is on our advisory board. She's also part of the team and are helping us tailor solutions for dogs and cats. Hi, Hilary.
Hi, Ronen.
Welcome to our podcast.
Thanks. I'm excited to be here.
Okay, great. How about you give us a background on yourself, how you got into the veterinary world? And, I haven't mentioned, you're a general practitioner, so you see animals every day, all day. So tell us about your experience getting into the world of veterinarian.
Sure. So it's actually kind of funny. Just going back to the very beginning, my mom has a piece of paper that I wrote on in kindergarten in, 1974 or 75. They asked us what we wanted to do when we grew up. And I wrote, with many spelling mistakes, I will be a doctor for horses and elephants. So I'm not quite seeing a lot of horses and elephants in my small animal practice, but the point stands. I always wanted to be a vet. It just was always my dream to be able to work with animals and help animals, and it's what I love to do. So I stuck with it.
That's awesome. Okay. And you are a managing director in a vet hospital.
Right, sure. When I was a senior student at Penn Vet School, I got married and got pregnant and then found myself in the position of looking for a job as a pregnant woman. And, there's a lot of issues about that here in the United States. But I was referred to a lovely man named Mark Bronstein in Ardmore, Pennsylvania, who was looking for someone, and he took me under his wing. He ran a very family-focused practice, and so I started there right after graduation in 2000. And as time went by, unfortunately, he became ill and ultimately passed away from his illness. And I, at the request of his widow, became the medical director of the practice. And, I've been there for 26 years now. And it's been a crazy, mind-blowing experience to see all of the wonderful relationships between people and their pets over all these years.
Do you have pets at home?
I do. Right now, I have a cat, a Maine Coon cat. His name is Gingy. It's Hebrew for redhead. And he is redhead. And we had a dog who was his best buddy, who unfortunately passed away in March. She was a 14-year-old Labradoodle. I have always had dogs in my life, and I imagine at some point in the future we'll be getting another one. It's a little too soon right now, but my cat definitely misses his friend, and we try to make it up by playing with him more. So we'll see what happens if we get him a new companion anytime soon.
Okay. And from your experience, both as a vet and as a pet parent and having kids, what does the human-animal bond means to you?
Well, humans have a very long history of befriending animals or forming relationships with animals, if you will, right? I mean, in ancient cultures, there were always proto-dogs and proto-cats living nearby and eating from our leftovers around the campfire or hunting for rodents and keeping them out of our food stores. And we gradually developed relationships with these animals and were able to what we call domesticate them. You know, they learned from us, we learned from them. Gradually, together, we changed and evolved into who we are now. And now we have these great friends, the cats and the dogs, and we have, you know, horses who love to participate in all kinds of sporting events with their handlers who are, you know, some people say, oh, it's cruel to make an animal do this. I have seen people walk into a barn where people are using a horse that's 30 years old to give a riding lesson to a young child, and they'll say, oh, I can't believe you make him do this. And the fact is, this horse loses his mind if he's not allowed to have a couple lessons every week. This is his retirement dream, you know. And I just love that we work together.
And from your personal experience at home, the human-animal bond, what has it meant to you and your family over the years?
Well,
I mean, you just lost a dog, right?
Yeah.
He was 14 years
Yeah.
old. Yeah.
sad.
Yeah.
So, you know, that's a painful part of it. And looking back, when my oldest child, who is now 25, was maybe 4 years old, we were sitting around the breakfast table, and he looked at me and he said, Mom, why do other people have cats that live, but we only get cats that die? And I thought, oh, God, it is too early in the morning for this conversation. But I tried to explain, you know, we had the misfortune of having a number of cats from the same breeder in a row who all had early deaths due to some type of congenital issue. And I explained to him, you know, sometimes people or animals are born with conditions that will make their lives less short, but it doesn't necessarily mean they're less valuable. Didn't you love Oscar? Didn't you love Kanga? You know, yes, they were part of our family and you miss them, right? Yes. And why didn't they live long? Well, that was just bad luck. You know, we couldn't do anything about it because if you're born with bad kidneys and you're not a candidate for a kidney transplant, then there's not a lot to do at that time to make you live longer. So we just had to make the best of the time that we had, which we did. And I think, you know, he took that okay. And I think that might be one of the foundational reasons he's decided to become a doctor and is now in medical school because he wants to fix those kinds of problems. But, you know, we eventually did get a cat who lived and a dog who lived. And they have been just such a wonderful source of comfort to us. You know, as a family, I know you've had a family and I have a family, and everyone who has a family knows there are always sometimes issues. You know, somebody gets their heart broken, somebody hurts themselves, somebody gets very sick and you're worried about their survival. And for me, and I very visibly see this for my husband and children as well, knowing that I can come home and sit down on the sofa and my dog or my cat is going to come and they're going to sit with me and I'm going to just feel that love coming from them, it's precious. It's a very precious thing. And to know that these creatures who aren't people and aren't thinking like the way that we think and have their own, I don't want to call it like belief system, but I do feel that animals, every different animal has its own internal thought process, if you will, and it's not fully understood by us. We don't really, you know, we can observe their behavior, but we cannot read their minds. So it's incredible to me that these animals seem to really value just sitting next to me. You know, they take equal comfort. Yeah. And I think we all need that kind of unconditional love in our lives.
Yep.
And sometimes I mean, it's great, to have a husband or a wife or a mom, a dad, a brother, sister who is always there for you. But one day they're going to say something that rubs you the wrong way, and you're just going to be so annoyed. And then you can go sit with your dog and have a conversation with the dog about it and feel better.
Yeah.
So.
Yeah, absolutely. And is there any, in this interaction with dogs and cats, is there some biology, chemistry that happening?
Certainly there are studies that show having a pet, people who have pets are less likely to have high blood pressure and less likely to have other, chronic stress-related conditions. So definitely something is happening where the presence of the animal in the person's life is helping them biologically. And, it's funny. Sometimes people will say to me, why do you push dog food or cat food on people? Why isn't it better to just let them eat raw animals, prey animals, like they do in the wild, right? And I was like, well, have you seen the lifespan of a wild cat? First of all, it's going to be hit by a car, but if it's not, they don't live as long without the help that we give them. And I think that for them as well, not having people in their lives would result in physiological stress, mental stress, and shorten their lives.
Okay. Switching gear to something else. So when it comes to your experience at the clinic as a general practitioner, dogs and cats, what do you do the most? Is it kind of break-fix type of visits, or preventative care, or a mix of both?
It's definitely a mix of both. And I think that there are times when sort of the underlying conditions of society change and make one thing more likely than another thing. So when the economy is booming, we'll often see a lot of younger animals for initial care, initial vaccines and exams, and preventive care. And when there's an economic downturn, we're more likely to stop seeing as much preventive care, stop seeing as many new pets, and see a lot more of sick animals that probably should have come in last week, and now have more serious problems. And that can be a source of frustration for veterinarians and for staff, and a source of grief for pet owners who, might wish that they had realized the consequences of waiting to come in. But I would say mostly, in my practice, I'm privileged to work in an area that has pretty much a good, stable economic base. And so I still do tons of preventive care as well.
Okay. What does it mean, preventative care? What type of visits?
So when I say preventive care, I mean the kind of care that will help us to identify problems before they have started to show clinical signs to the average observer, right? Like, it would be pretty clear to someone that their cat had heart disease if their cat was struggling to breathe, was collapsing unexpectedly, had purple lips, purple tongue, was developing weird swellings or making gurgling sounds or coughing a lot. These are all things that you could see. And I don't want to diagnose heart disease in that cat. I want to diagnose heart disease in the cat who comes in and the owner doesn't have any concerns. The owner, as far as they're concerned, this cat is fine. I do my physical exam, and I think, there's something about the sounds that I'm hearing, the way the cat's acting. maybe the color, whatever it is that I'm finding, I'm saying, I want to know more. And maybe we'll run a blood test called a BNP and find out that this cat has an elevated marker for this peptide in their blood that leaks out of injured heart muscle cells. And so I know, hey, something is stretching that cat's heart. The cat doesn't know it yet. We didn't not know it yet. But now we can, do additional diagnostics, find out exactly what the cause is, and hopefully intervene with some kind of medication or other plan to fix the problem and allow the cat to live without having clinical evidence of heart disease.
Okay.
Does that make sense?
Yeah. You touched a bit about it. What's most frustrating about your job when you see a dog or a cat? Like you see hundreds of patients a week. What is the most common thing that you see with pet owners, with pets, that you're saying, ugh?
Well, I could take this in a few different directions. One of the most frustrating things that I see is when I know what's wrong and I know how to fix it, and the owner either does not want to or is really unable to allow me to proceed with care. That's just, inherently in our system an unfortunate reality, because sometimes people can't afford it.
Is financial constraint mostly? Or?
A lot of times, one of the most common causes of euthanasia in pets is diabetes. We can treat diabetes very well. I'm not saying it's always the easiest or cheapest thing to do, but it's certainly something that, for me, I would always want to at least try. But some people know that they just cannot afford it, the ongoing expense of insulin and syringes and rechecks and yada, yada, yada. And some people are just too squeamish to be giving their pet injections. Sometimes the animal's behavior doesn't really allow for it, but the vast majority of animals with diabetes could be cared for were there not problems about finances or practical matters, like the owner's life is not set up to allow for a strict schedule, and that's, I would say financial euthanasia, what they call financial euthanasia, is one of the most distressing things to me as a vet. Nobody wants to do that. But there are also things like the fact that so many people who love their pets and truly believe that they are doing the best thing for their pet are very easily swayed by influencers on Instagram with their amazing tooth powder that's going to cure their pet's dental disease, which, pro tip, it is not, or the raw freeze-dried foods that have all the benefits of raw without the danger, which is also, pro tip, not true. And so then I have people who are spending all this money on all this stuff and their animal's not getting the care that it needs. And then I try to explain, hey, listen, we have large bodies of data that show us raw foods, even freeze-dried ones, because, when you get a vaccine vial that has a modified live vaccine in it, it's freeze-dried, that little pellet. It doesn't kill anything. I can reconstitute it, and it can become alive again, So don't tell me that the freeze-drying of the food is going to kill pathogens. That's a pet peeve. But I have to explain to them, why I don't want you to feed raw food. I don't want you guys to get foodborne disease. I don't want your pet to get foodborne disease. This is a big problem. And, they say, oh, well, you're in bed with big dog food or whatever. And I'm like, that's not actually the case. I'm more interested in promoting the health of your pet and the public health in general. And people sometimes say, oh, I wish I'd talked to you before we bought all this food because I wouldn't have spent so much money on what you're telling me. I shouldn't have gotten it. But then there's other people who unfortunately have, you might say, drank the Kool-Aid, and they truly believe. And that is very frustrating, is very difficult. And I've been doing a lot of continuing education stuff to teach myself how to sort of meet people where they are and try to influence them to accept scientific fact over the pretty ads on Instagram. It's very difficult, but I try.
When it comes to aging, dogs age much faster than us. Does it mean that we actually have less time to act and help them live longer?
Well, I mean, I guess it depends on how you're defining that. Certainly, if a human can live 85 years or 95 years, that gives you a longer time to act than you have in a dog who only lives, say, 15 years, right? I mean, that's just chronologically not possible to make up that time. But, if you start providing appropriate care during the animal's early years, you certainly have plenty of time to make their maximum lifespan as healthy as possible. It's not like if you don't start providing care by the time they're 3 months old, then you're completely out of luck. There's plenty of time to intervene and get a good baseline from lab work, which I forgot to mention that before. But one reason that I like to get a full, complete set of labs on the animal early in my relationship with them as sort of a baseline, So, no, does a 1-year-old dog have to have a full set of labs? I mean, no. But if they don't have that first set of labs and then they don't get it the second year or the third year or the fourth year, and then the fifth year, the owner says, okay, and then maybe my results show kidney markers that are perhaps mildly elevated. Well, what were they 3 years ago? Maybe they were the same. Maybe that's this animal's normal, because normal's not always what it says on the page. Sometimes normal is different. I mean, that's how they define normal in clinical labs. The 95% of healthy animals will fall within that range. There will be some on either side who do not, but there's nothing wrong with them.
Okay. So when it comes to preventative care, someone is going to tell you, well, my cat looks fine. She's only 4 years old. Isn't preventative care something that you start when it's much older?
No, I think preventive care really should start at the earliest possible age. And that will allow us the most time to pick up on early signals that will allow us to intervene in any disease process much sooner. Because our goal really is to give this animal the longest amount of what I would call high quality of life or asymptomatic life. I want this animal to be living its best life for as long as possible before it ever looks sick at all, before anyone has thought, oh, we need to do a diagnostic workup because something is wrong. So that's preventive care to me, to prevent these problems from arising.
Okay. What's the one thing pet owners are missing, are not seeing in their dog or cat because they're too close to them?
I think it's very hard for people to notice changes that occur gradually. When somebody's dog or cat is developing, let's say, degenerative joint disease or osteoarthritis as they age, they're starting to feel some pain when they move. They move around maybe a little bit less. They stop doing certain types of activities as often or at all. And, people don't necessarily notice that, today Fluffy jumped on the kitchen counter 17 times and then 3 weeks later would only ever jump up on the counter 15 times. They don't notice that. But it doesn't mean the degeneration isn't happening. And that's where physical exams can be really helpful, because when they come in to see me, even though the owner has not noticed that the cat is not jumping as much at home, when I do my exam, every time I palpate, like at the lumbosacral junction, maybe I'm finding that the cat turns around and goes, meow, because it hurts. And nobody had realized, right? So that kind of thing is important.
Sometimes I think we see that, we notice that as a dog parent or cat parent. I see the changes, but sometimes I'm just telling myself, oh, she's aging, she's growing, she's aging. So
Very common. Oh, you come into my exam room and I say, so how is Fluffy doing at home? And you say, great, Fluffy's getting old, slowing down a little bit. And I might say, well, tell me more about that. What do you mean? And then as the person is describing what they mean by slowing down, I can formulate a tailored response and explain that, it could be that the reason he never wants to go for a walk past the end of the block is because he's sore when he's walking that far. Or it could be that there's some degree of heart disease that when he goes for a walk, he cannot maintain that pace for as long and he just needs to sit down. We need to figure it out. But I think the most common thing, people think that their pet is slowing down because of some inherent factor that is age. They teach us in school, age is not a disease. It's just a social construct, if you will. And sure, there are physical changes that happen with age, but you can have the oldest man in the world be more youthful than somebody 10 or 15 years younger. And what does that really mean, right? You have to understand that what we really want to see and find and intervene with are the processes that accompany aging, but are not necessarily something that are inevitable in every organism, right? So if you've developed osteoarthritis pain, you don't have to be slow. You can take medication and still do all the things you want to do, right? And so can our pets often. I mean, we're not supernatural deities here. We can't fix everything, but we certainly can help a lot of these animals.
Yeah, it seems like we need some education about that. Like aging trajectory is not something that is just given. You can influence that.
Right.
And when it comes to that, with advancement in medicine, dogs or cats are living longer, right? You probably see that.
Yeah.
But the question is, is it worth it? And I will say why. A dog or a cat 15 years old that is not healthy.
You don't want to extend life unless you're extending high quality life, at least medium quality of life, Yeah.
Okay. What conditions or problem can actually be detected months and years before your dog or cat shows any signs?
I mean,
what's the typical ones?
Yeah. Chronic kidney disease in cats, so common, so common. And we can pick up changes in the serum chemistries and in the urine well before we see any clinical signs of disease. And we know that we can extend that high quality of life interval before they start getting sick by doing something as simple as switching them to a food, to a diet that supports renal function and helps the body deal with some of the changes that are happening that we wouldn't otherwise know about, and to help that animal stay healthy longer. So that's what comes to mind immediately. Certainly in dogs, I think it's more common that we'll pick up signs of something called Cushing's syndrome, which that's a hormonal disease. It has to do with making too much cortisol by your adrenal gland. And a lot of times people don't really notice the signs. I might examine a dog and think to myself, I wonder if this dog could have Cushing's syndrome, because to me, it looks like maybe its skin looks a little thin, its hair coat's not quite right, abdominal musculature feels a little bit lax, and maybe he's panting more than even is normal excited dog panting. And I think maybe, but the owner hasn't told me he has any signs of Cushing's disease, so I was not necessarily going to bring it up. But then I see on my blood panel that there's a marker for it that's elevated, and I think, okay, well, maybe we should test for this. And then I'll call up the owner and I say, hey, there's this syndrome called Cushing's disease. Are you familiar with it? And they'll say yes or no, and we'll go through the symptoms. Do you see a lot of panting? Do you see a lot of hunger? Do they always want to eat everything? Do they drink a lot and pee a lot, more than normal? And they'll say, oh, well, he's always been a stomach on legs, or he's always been one to drink a ton. And, I haven't seen these changes. I'll say, okay, well, humor me. Let's test him. And then, yes, I will find out he has Cushing's syndrome. And this is another thing they teach us in school is with this particular illness, treatment is designed to resolve the clinical signs, not to fix the underlying cause. Okay, I won't get into that whole thing right now. But so people will say, well, if he's not having the signs, why would we treat? And I'm like, I know that the signs are there, and people just aren't noticing. And so we will start treatment, and within a couple of months, the owner is usually coming back to me and saying, oh, my God, I didn't realize, he's so much more energetic. He's not waking up in the middle of the night to go out and pee. There's all these changes. Now that we're treating this, I didn't realize that all these things that I just attributed to aging were because of a disease.
Okay. Super interesting. How do I know if the diet that I give my dog is good or not? So from my experience, I'm going to go and I'm going to buy one of the best kibble food, one of the best wet food cans that are out there. But I always feel that there is something wrong with that because I am taught that don't eat processed food. Don't eat processed food, right? Because that's not good for you. And now I'm giving kibble. Most of what my dog or cat are going to eat is kibble. And I'm hearing from on both sides. So I'm hearing veterinarians and pet nutritionists that are saying, no, it's good for them. And there are ones that are going to say, no, you need to tailor it for your pet. How do I make myself comfortable that what I'm giving my dog or cat to eat daily is the right diet for them? Other than weight, other than the the quantity.
Right, sure. With dogs and cats who are fed standard commercial diets that are undergoing food trials and meet all the criteria to have the AAFCO label, that's AAFCO. They set standards for nutrients for different species, and they have one label that says this food meets the standards based on the recipe, and they have another label that says this food beats the standards based on feeding trials and measurement of outcome. And that is the label I would want on my pet's food. You can go out and you can buy dog food that has a label on it, says it's formulated to meet the nutritional needs of all life stages. You can feed this dog food to a puppy, a young adult, a senior, a pregnant female, anyone. It's good for them all. Well, okay, nobody's going to die of malnourishment on that diet. But I think if you think about it at all, seriously, you realize some of the animals eating that diet will have too much of something and not enough of another thing, and others vice versa, and it's not optimized for anyone. For a very young, rapidly growing animal who's building a skeleton and laying down muscle, you need a different nutrient profile than you do for an elderly animal who maybe needs to build up its muscle mass because it has lost some muscle mass because it has arthritis and isn't moving around as much. It's much easier to provide maximal benefit to the individual when you tailor these things to the individual. So that's why I always counsel my clients, you want to feed a diet that's labeled for use in the life stage that your pet actually is in. And yeah, they're more expensive, but sometimes you do get what you pay for.
Yeah.
So, one thing that I would say is look for that AFCO label for the feeding trials as a starting point. And there are always people who just prefer fresh food, not processed food, home-cooked food, whatever. And certainly there are multiple services where you can design a home-cooked meal under the supervision of a veterinary nutritionist who can help you formulate an appropriate diet for your pet. Most people who prepare meals for their pets at home really are not making sure to meet all of the standards because they haven't tested their food. They don't know what effect their cooking process is having on it and so forth. So, and this sort of ties back into what I was trying to say before regarding supplements. With dog and cat food, these are designed that they're comprehensive. So you shouldn't need a supplement if you are eating a commercial food designed for that life stage and you have no other underlying issues that are making something off balance. So I think that's a real big difference when we're talking about what we extrapolate from the human experience, because we don't have bags of human food that have everything we need and it's all balanced, and if you just eat that, you're good to go. We don't have that. We've created that for our pets because people find it convenient.
When it comes to longevity conversation, is there a reason cats are overlooked comparing to dogs?
Well, I mean, what comes to mind when I think about that question is that in dogs, we have lots of different lifespans that are considered normal. We have some breeds that really average very short lives, 6 or 7 years old maybe, and other breeds that we see routinely into the teens, approaching 20 or even older. I think when you have that much variability in the lifespan, it makes it a lot easier to tease out what specific biological components are affecting health and longevity. Cats seem to have a more highly preserved age complex, whatever the genetic forces behind the actual aging process are, it's much more similar. All cats have a roughly similar lifespan. There's no cat breed that only lives 5 years and one breed that lives 25 years. It's just more highly conserved. So it is less easy to tease out what the different changes are that we can make to affect that lifespan. This means dog research is funded more heavily because, again, like I said before, we can extrapolate that data and use it in humans, whereas with cats, we don't get as much useful stuff out of it. I also think you may have noticed, I certainly do in my daily work, that dogs in general seem to enjoy the handling process a lot more than cats in general. And we can do a lot more things with our canine patient without having to give them medication to sedate them, restrain them, etc. And cats often require what we would call chemical restraint or sedation to do things that we could do in dogs without needing to do that, just because they're not as compliant as patients necessarily.
And that's a question that comes from many pet parents. The anxiety of taking a cat to a clinic for a preventative care visit. Mm-hmm. Is it worth the hassle? Because as you were saying, cats can be very anxious and violent in at vet visits. Is it worth it? And can you really do the work that you need to help cats to get everything that you need out of the cat, whether it's blood work, vital signs, and all of that stuff to come up with the right measurements and recommendations?
There's a lot of options that exist, and most recently, I think it's pretty common. Most practices have transitioned to rely on pre-visit sedation administered at home by the owner to help facilitate handling of the cat. It's very common to prescribe something like gabapentin. This helps the cat to be more relaxed and allow us to do what we need to do without as much fuss. It has the benefit of preventing those hormone surges that accompany that stress response that can have an effect on lab tests and measurements of vital signs. So, sometimes people say they don't want to drug their pet because whatever reason they may have, they don't want to put a chemical into their pet. I'm like, listen, some kind of chemical is going to flood your pet. You want it to be cortisol and catecholamines because they're stressed out? I mean, personally, I'd rather have the gabapentin, but I can't convince everyone. So I guess what I'm saying is there's some degree of better living through chemistry that allows us to, in the modern veterinary world, have better luck handling the cats. But historically, it's been much more difficult.
Okay. Now, there is a difference between health span and lifespan, right? So we talked about cats. They can live until 18, 20 years old, maybe more. Is it necessarily that their last 3-4 years are just suffering because they don't have teeth anymore, they are obese, they are in pain? From your experience, have you seen cats that are the owners understand what it means over time to take care of them so their health span is longer and you see them live through their 18, 20, healthy? I mean, relatively.
100%. I mean, most of them have some degree of kidney disease by the time they get that age.
Yeah.
But if they've started early interventions and are keeping on top of things, I see 20-year-old cats who are living perfectly reasonable quality of life lives, who look a lot better than some younger animals that I see, which I think is what you were driving at. Because there are others that I see where, due to either financial reasons or philosophical reasons, or whatever other reasons they may have, the owner might only be interested in getting the minimum required care for their pet, which in many areas is simply keeping them up to date on a rabies vaccine and making sure that they have access to food and water. And if they do that, then they're perfectly happy with that, and it's their pet, right? So they can decide. But I definitely see the difference because those animals are not as healthy for as long. They're just not.
Okay. So some more do's and don'ts. Okay. Oral health. Do I need to brush the teeth of my dog or cat every day?
Yes. Yes. Why do you ask this? Do you need to brush your own teeth? Let me ask you.
Absolutely.
Okay. So why would it be different for your pet?
I don't know, maybe because he's eating kibble and it's a hard food and he's not getting sweets.
You ate tortilla chips every day. How would your teeth be if you never brushed them?
Yeah.
Just asking for a friend.
Yeah. How do you? But there are pet parents that don't brush their teeth because they don't know how important it is. So maybe you can talk about that. And then there are ones that wants to brush their teeth, but their dog or cat, they haven't started that from early age. How do I start doing that?
Okay. Well, the short answer, YouTube. There's so many great videos out there from my wonderful colleagues who have made wonderful teaching videos on how to do that. And I would encourage you to look them up. And you can even see some from board-certified veterinary dentists. you know, that is a great resource for pet owners. But, you know, I can certainly also say that when you start, I think the biggest mistake people make is that they get their toothbrush, they get their toothpaste, they get their pet. They're like, all right, we're going to brush your teeth. And they just go. They're like, okay, brush. And maybe, you know, they're trying to get away. And it just escalates into this snarling fur ball. And they say, well, that didn't go well. I can't do this. So what I tell people is, please do not sit down and try to brush all of your cat's teeth today. It will not work. Get yourself a toothpaste in a flavor that you think your cat will like. If you can't find a toothpaste flavor that your cat is interested in licking off your finger, then let's start with something that he is interested in licking off your finger. I don't know, get some tuna water. Dip the toothbrush in some tuna water. Brush one tooth. Then do something that your cat loves to do. Give it a high-quality treat, play its favorite game, snuggle on the sofa, whatever it is that your cat likes. And then the next day, maybe you brush 2 teeth. And then you do that. And eventually, you will be able to brush all the teeth. I mean, this is a gross oversimplification, but you understand positive reinforcement will do wonders. And if you're using a toothpaste that they like and you're being careful, I mean, brushing teeth is not the most difficult thing in the world. Most people do understand how to do it without causing pain. But I suppose for someone who might not be coordinated or might not realize their own strength, you know, they might need to be told specifically, be mindful of where you're pointing the toothbrush. Do not shove it down in the back of the throat so that they are gagging on it. Do not poke it up into the area where the cheek is connecting to the gingiva, because you could cause pain or injury. But as long as you're just brushing, you should eventually be able to get them to accept it, unless you have an animal with a more severe behavioral problem that would require addressing first.
Okay.
I could talk more about dental health. I mean, it's important to address the idea of periodontal disease early, because once it gets a foothold, there's no way that we can treat it and reverse it without anesthetizing that pet. And this is a really significant obstacle for some people. Some people just flat out can't afford an anesthetic procedure. Some pets flat out will not qualify for an anesthetic procedure because maybe they were born with a congenital heart disease or something structural, and they just really, it's not worth the risk. But if you don't brush their teeth, then they're going to develop dental disease. And at some point, the risk of developing complications of severe periodontal disease will surpass the risk associated with an anesthetic procedure for that pet anyway. But if we brush the teeth every day, we can stop them from having dental abscesses or pain associated with chewing that makes them lose weight, or even I have seen tooth root abscesses cause temporary blindness by creating so much swelling that it extended up behind the eye and pushed the eye, or, you know, even when you have some minor degree of gingivitis, that level of inflammation in the mouth results in pro-inflammatory changes and systemic inflammatory markers rising. And we see in those populations that do have lots of chronic inflammation in the mouth that they just don't live as long for a wide variety of reasons. And no one's going to say, okay, well, chronic gingivitis is a death sentence. It will kill you. It will make your heart stop. It will make your kidneys fail. No, nobody's saying that. But we do know that if you prevent that periodontal disease, animals who don't have that chronic inflammation going on tend to live longer, healthier lives.
So, Hillary, you were very helpful in, you know, putting our product together, tailoring it to dogs, cat, what to look at, what's not. When I'm thinking about, if I want to invest in my dog or cat in a preventative care program, coming to the vet every 6 months or doing blood work every 6 months, like some of us doing for ourselves for longevity, what's the benefit of it versus just going and doing regular blood work once a year? Do you get really much more benefits out of it? And if yes, why? Why is it important?
Well, you asked before about the lifespan of the pets and the time that we have to intervene. And I would say this is really sort of a case in point, that by checking the biomarkers more frequently, we are able to detect problems sooner. A year of my dog's life is a larger percentage of their life than a year of my life. If I'm going to the doctor once a year to maintain my health, but a chronological year is a much bigger percentage of the life, doesn't it follow that I should break that up and look more frequently to see if anything's changing sooner than that year? And I think that experience has borne out that it is. I mean, certainly once I've made a diagnosis of any age-related condition in a cat or a dog, I will tell the owner, okay, at this point, I would like to see your pet every 3 months or every 6 months or whatever it is, depending on the condition. Some diseases that develop with age, we have consensus guidelines from the experts telling us these cats should be monitored every 3 months or these dogs should be monitored every 6 months. And a lot of times we don't, because nobody can come to a consensus or it just hasn't been studied enough. But it's pretty clear that regardless of what the issue is, it's better to know about it sooner, even if you're not going to want to treat a condition. You know, some people say, if my dog has a brain tumor, I am not treating it. Okay, fine. You're not treating it. But if I know that your dog has a brain tumor that you're not going to treat, then my approach to relieving it of symptoms from that brain tumor is going to be different than if I don't know why your dog is acting weird. Because if I don't know, then maybe it's something that we could treat, right? So for these reasons, I think it's important to try to understand what's going on with the animal so that we can optimize the treatment plan for that pet.
Okay. And I think that's a wrap. Thank you very much, Dr. Hillary Israeli.
Very welcome.